All right, so my patient today presents in my clinic after a FOOSH injury. In a normal emergency setting, I would check the scene for safety, and since this is in a clinic setting, I assume the scene is safe. I am wearing the proper PPE equipment. So first off, what I'm going to do is check the patient's CMS of their, they come in with a right FOOSH injury of their wrist. Upon observation, I do notice some swelling upon palpation, and they do have some crepitus at their distal radius. So I'm going to be checking for CMS with the radial artery, and then I'm going to check for capillary refill by pinching their distal fingers, and I do see some capillary refill, so there's no occlusion or anything there. I'm going to have them close their eyes and ask them which finger I am squeezing.
Index.
Excellent, so there's no neurological damage there. All right, so next what I'm going to do, I'm going to get a SAM splint and to stabilize the patient, because I assume, due to the mechanism of injury, that it is a fracture, but I do not have any x-rays with me at the moment. So I'm going to stabilize the injury, and then I'm going to refer them out where they can actually get a radiograph. So first I'm going to place their arm in a neutral position, just grab onto that. I'm just going to get some gauze and a triangle bandage. So I'm going to stabilize the patient by, there we go, by wrapping the gauze around the patient, not too tight, but not too loose, and not tight enough where it's going to cause any occlusion and of the CMS or alterations. How's that feel so far?
Feels good.
Good, all right. Once the bandage and splint is secure, I'm going to recheck CMS, feeling for that radial pulse, and I'm going to recheck capillary refill, which it does. Then close your eyes again, and just let me know which finger I'm squeezing.
My pinky.
Pinky finger, okay. All right, next, I'm going to have the patient sit up just a little bit. I'm going to place the triangle bandage around them. So I'm just going to put this underneath you here. Sorry. Okay. Just rest your arm now. There we go. Just to stabilize the patient so they can get to where they need to go for a radiograph. All right, so I'm going to recheck CMS again just in case. And capillary refill. Okay, all looks good. So I will refer the patient out to a orthopedic surgeon, and then I will follow up with them as well to see how their patient's doing. And then afterwards, we could do a follow-up with rehab exercises and whatnot. That's it.